Good afternoon, everyone. About 1 million elementary school-age children and nearly 1 million younger children from birth to age 5 live in the state of Illinois. And nearly 1 million younger children from birth to age 5 are important to all of us, as are all the children of the state. As your governor and as a parent, I can say with confidence that every single one of our families has had to adjust their approach to caring for their children during the last several weeks. So today, I want to update you about childcare and what we're doing to help childcare for our essential workers and how we're helping our existing childcare landscape stay afloat through this crisis so that our kids still have a place to go when we get to the other side. To be clear, during this crisis, children who can stay home should stay home. And that means really at home, not going on play dates or hanging out with friends. As hard as this may be, we need our youngest Illinoisans to follow this guidance just like everyone else. Young people can catch COVID-19 and they can be carriers of COVID-19. But we have essential workers and healthcare professionals who can't stay home with their kids because they are heroically going out to do their jobs, which are vital for public safety and to make sure that other families can get the food and gas and pharmacy goods that they may need. Our essential workforce deserves to know that their kids are safe and cared for in a small and affordable group setting. I'm proud that here in Illinois, effective April 1st, all essential workers in healthcare, human services, essential government services, and essential infrastructure now qualify for the state's Child Care Assistance Program, meaning that the state will cover most, if not all, of the cost of care with our emergency child care providers. That includes everyone from nurses and doctors to support staff in hospitals to grocery store clerks and food producers. If you are an essential worker, full details and applications for assistance are available now on our Illinois Department of Human Services website and our state COVID-19 response website. That's at coronavirus.illinois.gov. When our stay-at-home order first went into effect and traditional child care centers temporarily closed, I announced a new emergency child care center license for providers, interested organizations, and parents and guardians within communities to increase the availability of safe, small group care for the children of our essential workers. As of this weekend, over 550 centers are running under the emergency child care permit. Additionally, over 1,500 home child care providers have reported that they're still providing care, many of them on the critical night and weekend shifts that are so important for our essential workers. I cannot stress enough the difference that all of these providers are making in the lives of not just the families that they serve, but all Illinoisans. Here's just one example of a center's impact. In Harvard, Illinois, in McHenry County, there is a Gold Circle of Quality certified daycare and learning center called Brown Bear, run by a remarkable director, Sheila Henson. Sheila has Brown Bear operating from 6 a.m. to 5:30 p.m., caring for the children of Harvard's community members who work in local grocery stores, on farms, and in the local milk processing plant. Sheila is not only providing an important benefit for those workers, she's also making it possible for everyone else to get milk that they process at that facility and the food that they produce. Nearly everyone in Harvard ought to be grateful to Sheila Henson. That's true for our home providers, too. In East St. Louis, Tina Branch Williams runs a home center caring for 6 children during the day and 5 others at night, making sure that the healthcare workers and first responders in her community have the support that they need. These emergency child care providers are just another example of the incredible ways in which Illinoisans have stepped up to maintain normalcy where we can, while we take up the fight against COVID-19. Honestly, we can't thank them enough. Last week, we announced that we were providing one-time stipends to providers to soften the financial impact of this crisis. Already, over 1,100 homes and centers have applied, and those who haven't yet can do so now by contacting their local child care resource and referral agency or by downloading the application from our coronavirus.illinois.gov website. We also made sure that our Preschool for All grantees and Prevention Initiative grantees had the flexibility that they needed to use grant funds to address emergency child care needs in their communities. Unfortunately, the federal Head Start program has actually done the exact opposite, making it very difficult for Head Start programs to use their staff or facilities to respond to the needs of non-Head Start families in their communities who may need care. I've urged the federal government to take a hard look at what we're doing here in Illinois and reconsider how they're operating Head Start until we get through this current crisis. Today in Illinois, we're building on our support for emergency child care centers, helping out the ones already running and hopefully encouraging others to join. We will be paying enhanced reimbursement rates for emergency child care effective April 1st of 30% above the rates that we usually pay to reflect the additional costs of providing care in smaller groups. Child care centers that are interested in reopening as emergency centers can still apply for a permit through the Department of Children and Family Services. Finally, I want to address the health of our state child care landscape for when we cross the finish line of our fight against COVID-19. By and large, child care in this country is a high-risk, low-revenue business with razor-thin margins. The people who run our centers and homes do so because they love to be there for our kids and our families. We know that we need to provide support to those programs that have had to close during the stay-at-home order, as well as those emergency centers who aren't able to operate on the same scale as normal. I want to take a moment to acknowledge our Office of Early Childhood Development here in Illinois for their creativity in responding to this crisis. In large part because of their work and ingenuity, Illinois is being recognized on a national level for its leadership in responding to the needs of its early childhood and child care system in this crisis. Already, we've created a simple waiver process that allows child care providers to be paid for all of their enrolled children in the Child Care Assistance Program for March and April, so that the child care staff could continue to be paid as normal through this unprecedented period. Doing this ensures that our child care staff are able to put food on the table and to care for their families so that they're ready and waiting to welcome kids back into their care when this is all over. The Governor's Office of Early Childhood Development is providing a webinar tomorrow morning on Monday to help providers learn about what is available. Providers interested in tuning in can find registration information again on our state coronavirus website, coronavirus.illinois.gov. I want to thank you all for joining us this Sunday, this Palm Sunday, and I'll turn it over to our Department of Public Health Director, Ngozi Ezike. Doctor?
Thank you, Governor. And as you've heard, the Governor is very interested in the welfare of the children and the people who take care of them, as he is for every resident in the state of Illinois. And I just appreciate and thank you for your dedication to everybody in the state. Good afternoon and happy Palm Sunday, yes, to those who are celebrating across Illinois. As a person of faith, I know how important these days are, as well as other important days like birthdays and anniversaries. Please know that you can still celebrate your faith and you can observe special days like today or like birthdays, but while at home. I urge faith leaders to continue hosting services online. We need and want everyone to stay home. Once this pandemic comes to an end, we'll all be able to worship as previously and celebrate our treasured milestones together. We do have to do things differently because we're fighting an enemy that we've never seen before. Today, the Illinois Department of Public Health reports 899 new cases and another 31 loss of life. This brings our statewide total to 11,256 with 274 deaths. Among those lost is a second individual from the outbreak at Stateville Prison. This individual was at a local hospital. There are currently 60 positive cases at this congregate facility. You all know, like I know, that these numbers represent people. They represent our fellow Illinoisans. We should continue to do our best and keep everyone safe by staying home, washing our hands, and physically distancing. These three simple actions can keep you and your loved ones healthy and ultimately save lives. IDPH and local health departments are working around the clock, ensuring that communities and facilities don't become inundated with cases by getting out timely education and providing technical assistance when needed. All of this so that we can flatten the curve. Much attention has been given to the data we have shared regarding the race breakdown on our webpage. About 30% of positive cases are African American. We know all too well that there are general disparities in health outcomes that play along these racial lines, and the same may be true for this virus. We have worked to ensure that all of our communities can access the health care they need as COVID-19 spreads, and we will make sure that resources are directed where they are needed most. Even before this pandemic, we have worked tirelessly to address the health disparities that exist among our Black and Brown communities. And that work to expand access to care in our underserved communities will continue both now and long after this pandemic has been conquered. I understand the safety precautions that we take and that we're asking everyone to take are unprecedented. I cannot stress enough how serious we must take this situation. Many people are complying, and to them I say thank you. To those still feeling like they have to take the entire family to the grocery store, please reconsider. There's no need for everyone to be out there because we are all at risk. I began my remarks yesterday with a plea for everyone to stay home, and today I end with that exact same plea. Stay home, protect yourself, protect your community. We will get through this together as one Illinois. And now I will summarize comments for our Spanish-speaking population. Buenos tardes. Feliz Domingo de Ramos a los que celebran hoy. Soy una mujer de fe y sé que importantes son los días como hoy por mucha gente. Igualmente importantes son los aniversarios, los cumpleaños y otras fechas. Quiero que todos tengan en cuenta que pueden celebrar su fe y observar días especiales como cumpleaños mientras están en casa. Pido a los líderes religiosos que continúen servicios por Internet, si es posible. Queremos que todas se queden en casa. Cuando esta pandemia llegue a su fin, todos vamos a celebrar todos estos días juntos. Ahorita es un tiempo especial a causa de este virus, pero eso necesitamos hacer cosas un poco diferentes. Hoy, el Departamento de Salud Pública aquí en Illinois informa 899 casos nuevos y 31 muertes conectados a COVID-19. Esto eleva nuestra total a 11,256 con 274 muertes. También estamos anunciando una segunda muerte en Stateville. Esta persona estaba en el hospital. Tenemos 63 individuos en aislamiento, 49 son COVID positivos y 14 todavía están bajo investigación. Ustedes saben, como yo sé, que esos números representan personas, representan a sus compañeros de Illinois. Debemos continuar haciendo nuestro mejor esfuerzo y mantener a todos seguros y quedarnos en casa, lavarnos las manos y distanciarnos socialmente. Estas 3 acciones simples pueden mantener a usted y su familia saludables y, más importante, salvar muchas vidas. IDPH y los departamentos de salud locales están trabajando las 24 horas para garantizar que las comunidades y los hospitales no se inunden con casos de COVID-19. Entiendo que las precauciones de seguridad que todos debemos tomar no tienen precedentes. Muchas personas están cumpliendo y les agradezco. Para aquellos que todavía están tomando las compras de comestibles de toda la familia, ya no lo hagan, por favor. No hay necesidad de poner en riesgo a toda su familia. Comencé mis comentarios ayer con una petición para que todos se queden en casa y hoy termino con el mismo motivo. Quédense en casa, protégese y protege a su comunidad. Vamos a salir de esto juntos como un Illinois. And with that, I will turn the podium over to Governor Pritzker.
Thank you. Happy to take any questions from members of the media.
Thank you, Governor. Mike Puccinelli with Channel 2.
You've been watching a COVID-19 news conference with Illinois Governor J.B. Pritzker. We want to run through some things just in case you missed part of it. 899 new positive cases in Illinois, 31 new deaths, bringing the total of positive cases in the state to 11,256. We reported that the state passed the 10,000 mark yesterday. Today, passing the 11,000 mark, the death toll for the state, 274. Now, before we got to those numbers, the governor addressed child care specifically for essential workers, saying that as of April 1st, all essential workers, whether they are working for the government, working in grocery stores, are eligible for the state's emergency child care assistance program, meaning that the state will actually offer financial support for that emergency child care. He said that there are hundreds of centers, emergency centers and at-home centers that are working right now to serve those essential workers, and he's actually encouraging other centers who are not operating right now to apply to be emergency centers if they feel that they can help. Also important to note that the governor actually came out in a mask for his press conference. He took it off to speak, but this is just 2 days after the CDC recommended all Americans wear masks to stop the spread of COVID-19. We will keep you updated with the latest on our app, online, and on air during our next newscast at 5 o'clock.